And I want to start by saying welcome everyone to this Where Next webinar, where we'll be answering some of the most common career development questions that I get from young public and global health professionals, but we'll also have time to answer some of your questions. So just to tell you a little bit about me, my name is Candela Iglesias. I'm originally from Mexico. I've lived in many countries in the world, and today I'm based in Norway. I'm a global health specialist, and I am also the founder and director of Alanda Solutions for a Healthier World. And I actually trained as a biomedical scientist, and I did my master's and my PhD and my postdoc in microbiology and virology. And after all that, at some point, I decided that I had enough and that I wanted to change careers. And this was about 11 years ago. And I was very unclear of what I wanted to do next, but I had a hunch that it had to do with global health. I had no idea how to get there, or even, who could I even start asking for some advice. But eventually, a lot of lovely people sat down with me and gave me time out of their busy schedules and gave me advice that allowed me to switch into a global and public health career. So I did a master's in public health part-time, and I also landed my first job after sending a lot of job applications that never got answers or got rejected. And then when I got that breakthrough, that allowed me to start peeking into the whole world of global and public health. Fast forward 11 years, and I have built a successful and especially very meaningful to me career in global and public health. I have worked with a huge variety of different organizations. I have worked in the public sector, both in agencies, in the ministries of health, or with the government, but also directly in healthcare settings, in hospitals, in primary healthcare clinics. I worked with large humanitarian organizations, with small local NGOs, with the UN agencies, with the private sector. So I know I'm quite acquainted with the huge variety of opportunities and careers that exist out there in global and public health, and I'll be sharing a little bit of that today. So why this webinar? Over the years, I also started formally and informally mentoring young public and global health professionals, or people who, like me, wanted to switch careers into public or global health. And I started to see that the questions were very similar. They sort of came back. Many of the same questions kept coming back. And some months ago, discussing with our interns at Alanda, who are also young public and global health professionals, we decided that maybe there was a gap here that we needed to do something about, and to start building some resources to fill that gap. So this webinar is our first attempt at that, and at the end of our session today, we'll be talking about some other resources that we're developing, in particularly a course that we're calling Thrive, but more about that later. So let me just talk very briefly about what we'll be covering today, and then we'll jump right into it. The first thing I want to talk about is, what are my career options outside of academia? The second one is, should I do a PhD? And the third one is, why do I keep getting rejections or no answers to my job applications? And these are by far the top 3 questions that I get from most people that I talk to. Then we'll have about 20 minutes to focus on the questions that you have. So please add those to the Q&A chat. As we go along, as you have them, if you already have them prepared, feel free to just add them in, and we'll prioritize those and try to tackle as many as possible. And finally, I'll be presenting some of the additional support and guidance resources, and an introduction in particular to the Thrive course that we're putting together. Okay, so let's just jump right in. The first thing I want to talk about is, what are your options outside of academia? So academia is a little bit like a bubble. You're doing your master's right now, so you're inside that bubble, and the people around you, the professors, some of the researchers, your peers, everybody is in that same bubble. So it can feel very vague or very hard to figure out what else is out there as career options, or even how to make that jump. So I think the first important thing is to learn that you can do a lot of different things with a master's in global or in public health, or any similar sort of degree, right? Because there's many degrees that go by another name but teach you the same skills. Let's try and break it down by categories, and then let's talk about the different types of positions and work that you can be doing. So in terms of categories, we have first the public sector, but the public sector is everything. It can include healthcare, working in hospitals, even if you're not working directly with patients as a clinician, but working in hospitals, working in primary or secondary healthcare settings. It can include working in agencies, surveillance agencies, public health agencies, etc. You have the NGO world, everything from the large humanitarian international organizations that we all know about, Doctors Without Borders, CARE, the Red Cross, all these big ones, that some of which are specialized in different areas. Some more work with refugees, some work in disasters, some in protracted conflicts, etc. And many of these large international NGOs work both in humanitarian settings, emergency settings, and in development settings, in sort of long-term program settings. Then we have the small, and then from the large organizations, you go all the way to the small local NGOs, and there's a huge variety of options there. You have smaller international organizations that are not as well known, that work in a fewer number of countries. You might have national NGOs, you might have local NGOs, regional NGOs, and with a huge variety of thematics. Some very focused on health, some will have health and other program components as well. In general, the smaller the organization, the more hands-on that your work will be. But this is just like a general guidance, right? So the larger the organization, the higher up it tends to be from directly implementing a project, for instance. Again, this is a generalization. So we also have the UN agencies, of course, WHO, PAHO in the Americas, you have UNICEF, and many other UN agencies also have some health components. So there's always options in the UN agencies for work. This tends to be more technical advice type of work. It's not going to be usually about direct implementation. Many of these agencies normally would subcontract local or national NGOs to do some of the program implementations, but they have technical support. They collect data, they analyze data, they do policy work, guidelines work, etc. We have, and this is where things get a little bit more confusing, we have a lot of other multilateral organizations that are not the UN. You have the development banks that also have health programs and also need public health and global health people. You have this is like the World Bank, the International Monetary Fund, all the regional development banks. And then you have other actors, and these are becoming more and more common. And many of these are what we call public-private partnerships, or PPPs. And these are things like Gavi, like the Global Fund for HIV, tuberculosis, and malaria. So they have these actors normally act as both donors, so they give money for NGOs and for others to implement programs, but they have also started taking a very impressive role in improving technical capacity, in creating technical guidelines, in all the technical aspects of health work, I would say. So there's a lot of project management, grant management, and also technical advice, monitoring and evaluation. A lot of these type of positions will exist in these organizations. And there's a lot of it. Some of the newest ones around are CEPI, the Coalition for Epidemic Preparedness Innovations, and the Global Funding Facility for Maternal and Child Health. And then there's a large amount of partnerships, and these are collections of NGOs with other partners that work together towards an advocacy or a technical development or a coordination role. One example would be the Partnership for Maternal and Child Health, for example. What else is out there? And then there's the private sector. And when we say private sector, people tend to think, oh, the biotech and the biopharmas and so on, or, the health tech sector. Yes, but that goes from the tiny startup that is just starting with maybe a single product or a single project or a single idea, to the big biopharmas that rule the world, as we know. And there's a huge variety of opportunities there. And again, the smaller this private organization is, what's going to happen is that you probably have to use a variety of different hats. If you're in a very large organization, you have a very specific role, very clear job description. Whereas if it's a smaller organization, what tends to happen is that you need to play different roles. You need to learn a little bit about marketing, a little bit about sales, a little about product development, a little bit about technical advice, a little bit about everything. So it can be very interesting if you like to have that diversity and learn about a lot of things. But in the private sector, there's not just the pharmas and the tech organizations. We also have all the consultancy and support organizations that provide services to the whole long list of other organizations that I've talked about before. So these can be consultancies, people who provide external services such as evaluations, needs assessment, trainings, events, management of events, connections, science communication, social communication, PR, whatever you can think of, there'll be an organization that provides this type of service in global and public health. And if they're working with clients in global and public health, they'll need skills from people with a global or public health degree. And then there's a new, not so new, but a new player on the block, which is the social enterprises. And these can be for-profit or not-for-profit. They can have different registrations, but they usually have a for-purpose, or like they're based on purpose or a mission, not on a financial bottom line. And there's more and more of these, and they tend to be able to mix business skills and business knowledge with not-for-profit and sort of getting financial grants, etc., from donors. So a little bit of a mix. And they can be very interesting. Again, it goes from all sizes, from very tiny to very big. And then finally, of course, we have academia. Now, I won't talk a lot about it because you all know more about academia than about anything else. But basically, in academia, don't think about it as only sort of desk-based work. You could also be a researcher in implementation science, like operational research, right? So actually working in projects that are being implemented in different areas of the world, where you can provide knowledge of how to actually collect data to see if that project is working. So keep that in mind when you think about academia. It's not just all teaching and desk-based research projects. You could also work for the National Institute of Public Health, which is in many settings considered also a sort of an academic body in many countries, etc. So a huge variety of opportunities. You can use your technical skills, you can use your project management skills, you can use your science communication skills, you can use your advocacy skills. There's many of these organizations that work in advocacy. And of course, the research skills are cross-cutting and can be useful across many of these different settings. So really start looking into what you like and what are your skills the skills that you like to apply, and try to figure out among all this huge variety what could be a good match. Wow, I talked a lot there. Okay, I'm going to keep the ball rolling and just go straight into our second most common question. and that is, should I do a PhD? And by the way, if you have any follow-up questions or anything that I've said, brought a question up in your mind, make sure to add it in the Q&A chat, please. Okay, so should I do a PhD? This is another question that I get a lot from young public and global health professionals. The answer is it depends. And I know that's the most annoying answer ever, but it really depends on where you want to go with your career. So let's talk about where or when is a PhD important. If you're going to stay in academia, if your goal is to stay in academia and do research or be a professor or teach, etc., you do very well by starting a PhD. It's going to be very useful in many settings. Is now actually a requirement for many positions in academic settings. What does a PhD mean? If you have a PhD, what this means is that you're very good at doing research, basically. You would get highly trained in the science and in the scientific method. Your mind will become like completely scientific method oriented. It'll be a new sort of way that you see the world, much more than today after your master's, which you've already experimented a little bit with that. And you'll get very good at doing research. That's the reality. And that research, but of course, research skills can be useful outside of academia as well, as I already mentioned. And having a PhD can be an advantage in certain settings, particularly in very sort of highly desirable positions, potentially in the UN or in other, let's call them fancier organizations. But I would say, for example, in the NGO world, probably not so much, unless it's a very particular research position. And you can do research without having a PhD. And in many cases and many organizations, for many positions, they would consider a PhD or years of experience as like a sort of like at the same level. Because of course, if you do a PhD, you'll have 4 years of research experience or however long your PhD takes. But if you, during 4 years, similar 4 years, were working in research in another setting without doing a PhD, that also counts. So it's not always necessary to have a PhD, and you need to think carefully if you want to do it. And what I always tell the interns at Alanda is, if you're in doubt, wait. You can always do it afterwards, okay? Because it also has an impact on how you live your life as, as a student, as compared to as a student versus a professional already who has a job, okay? So that would be my own piece of advice. And by the way, just remember that I'm sharing everything that I think here. And of course, there's people who will have different opinions than mine. It is actually very useful if you seek a diversity of opinions on these topics. So just as a disclaimer. Okay, have I covered everything? Yes, okay. Let's talk now about the third question, and that is, I guess many of you have been going through this. You've been applying for jobs, and you've been sending out dozens, hundreds of job applications, and you're either not hearing back or getting rejection after rejection after rejection. Let me show you something. Let's try and dig into where is the problem here. Why is your job application or your job hunting not working? Give me 1 second here. This is the slide I want to show. Let's start by understanding, where are the jobs? If you imagine an iceberg like the one in this picture that I'm hoping you're able to see, please ping me if you cannot see it. The part on the top of the iceberg, that tiny part on the top of the iceberg, those are the jobs that get advertised. The huge part in the bottom of the iceberg that is underwater, those are the jobs that never get advertised. And if this is news from you, think about it. Every day, thousands, if not millions of jobs get created. And many of those jobs never make it out to Relief Web or whatever it is, whatever job searching engine you're using to look for jobs. And that is because they already have a candidate internally or even externally, someone that they already know. Or because they just met someone, realized that this person would be fantastic for a need that they had, but they hadn't thought about turning into a job, and then out of sudden created a job for this particular person. And you never get to see that job advertised. So the relationship between the part of the iceberg that is over the water and the part of the iceberg that is under the water changes from city to city and country to country. But so in some parts, you'll have maybe 40 or even 50% of the jobs that do get advertised. And of course, it's very hard to measure. But we know that this happens everywhere. Not all of the jobs get advertised. And in many, many settings, most of the jobs never do. So what you are targeting, if the only way in which you're applying for jobs or looking for jobs is by answering job adverts, what you are targeting is the top of the iceberg. It's not a very efficient mechanism for job hunting. This is hard to hear, I know. I've been doing this for years myself, so I know. And this is also why you don't get answers, because what happens, let's look at this from the perspective of let me close this. Let's look at this from the perspective of the organization. If I'm a large organization, I'm going to say UNICEF, but I don't want to make them into the bad guys, but let's say I'm UNICEF. I'm a very large organization. I have a huge HR department or a variety of HR departments. And I set out some job advertisements. And I put them on my website and I put them on other websites and so on. They will get a ton of applicants. But who reads those applications? It's the HR people. So what you need to understand is many times, unless it's a very small organization, many times when you're sending a job application online, the people that are reading your CV and your cover letter, your application, are what we call gatekeepers. These are the HR people. They're not global health professionals in most cases. They are HR professionals, and their job is to keep the great majority of people out and just let a very small trickle of people into the organization. That's their job. I mean, it's not fair for us on the other side, but that's their job. Okay. So the thing is, when you're applying to jobs online, you are applying to a tiny percentage of the jobs in existence, and you're reaching gatekeepers whose job is to get you to keep you out and not bring you in. And they're not global health people or public health people. So what to do instead? Okay, now I've managed to depress you. You're like, oh my gosh, I'm never going to get a job. No, there's much better ways to do this. And that is about networking. And if you're rolling your eyes at me right now and saying, oh, networking, everybody says that, just stop saying that. Let's talk about what networking is and what it isn't. Networking is not going to a conference or an event and meeting two people and never hearing back from them. That's not networking. Networking is not having a LinkedIn profile and just liking everybody or following everybody. That's not networking. Networking is about relationship building. And that relationship, by definition, is a contact between two people that happens more than once. Okay? So what you're trying to do with networking is building relationships, because it is through these relationships, and this has been studied in many, many countries, in many, many different cities around the world, that people actually get jobs. So if you're new to a field, you need to start building relationships in that field. And you might say to me like, oh, but this is like a very long-term thing. It'll take me forever and so on. Yes, maybe. but at the same time, it's taking you forever to apply for jobs online. And the majority of these jobs, you're not even hearing back if they read your application or not. So it's up to you. But in general terms, it's a good measure to have like 50% of your time applying to jobs online and 50% of your time that you're using for job hunting dedicated to relationship building. So what do I mean by relationship building? Let's look at this like with an example. Say I'm interested, I've looked at the different organizations, I've been looking at jobs online, and I'm starting to get a feeling that I would like to work for CARE. CARE has some health programs, are highly integrative, sounds interesting. I would like to work for CARE. And, I know that there's a CARE office in country X, which, works for me because I could move there or I could work remotely or whatever it is. So what do? I can start looking on LinkedIn for people who work there and start following them and getting to know them a little bit and commenting on their posts and just maybe sending them a message and so on. And then what you can do is ask people for a short chat. And I get tons of these requests on a weekly basis. And I try to say yes to as many of those as I can. And not all people are like this. Many people will say no, and that's okay. But there will be people who say yes. And actually, you would be surprised by how many people will say yes. The trick is it never has to feel as if you're asking them for a job. Because if you try and ask me for a job, I know I don't have any jobs available for you. So like, why would I meet with you? Okay. So never make it sound like you're looking for a job. You need to send a message that says something like, oh, I am finalizing my studies. I'm trying to figure out what I would like to do next. I've been looking at your posts on LinkedIn or whatever. I've been looking at your organization online, and it seems like it might be an organization that could be a good fit for me, but I'm not sure. And I would like to speak to people who are working there to understand what this organization is about and what this positions, what are the types of jobs that exist in there. And this is very non-threatening, right? You're basically just asking me for 20 minutes of my time. I can hop on a call online. If we live in the same city, you can invite them for coffee. You can make it easier for them, just go to wherever is most practical for them. And then you talk to them and you spend most of your time listening. And basically what you're asking them is for advice. And it's human nature that we all love to give advice. It's just human nature. So if you ask people for advice, they will feel flattered. They won't feel threatened because you're not asking them for a job, and you can get really good understanding and also start building a relationship with that person. And there has to be there has to be some, curiosity and openness. It can't be transactional. It can't be like, oh, I'm trying to build a relationship with this person because I really want to have a job with them in the future. That doesn't work. It needs to come from an honest place, right? You're curious about their jobs, their organization, whatever. And then if that's all you do, that's already very good. But what you need to do is continue that relationship. So continue, first you send a thank you email, commenting on some things that the person said, saying, oh, this was very useful for me. I've been giving this a lot of thought, whatever. And, a couple of weeks later or a month later, you send them, oh, we talked in our conversation about this and this, and I found this article that I thought you might enjoy. You just keep the conversation going in a very casual way. But what you're doing is keeping on top of people's minds. So if you, for example, today ask me for a if one of my colleagues at a large organization asks me for a recommendation of someone for a job, that they're looking for candidates for a job, and they ask me for a recommendation, if I talked to you yesterday, I have you on top of mind, and I might think, oh, this person that I talked to yesterday might be a good candidate. Actually, let me connect you with them. Okay, so try to keep on top of people's minds, but don't be spammy. Like, don't be sending them an email every day or an email every week, right? Keep it casual. Just keep touching base with the people and have a strategy for this. The last thing I want to say about this before moving on to your answering your own questions is this is my golden tip. I call it my golden tip. Whenever you have a conversation with someone in this relationship building, whether it's online or offline, never leave that conversation without asking them this question. Now that I've talked to you about what are my interests and where I would like to go next, who else do you think I should talk to? So leave that conversation with a name, and then ask them, would it be okay if I reached out to this person and say that you told me to contact them? And then you have like a door opener, right? Because if you tell me that my friend Mary told you to contact me, I will be much more likely to hop on a call with you than I'll be if you just reach out cold, right? So always leave that those conversations with another name so that you can continue that chain of building relationships. And before you know it, you'll start having people contacting you for jobs, or you can this way you sort of bridge the gatekeepers. You reach the people who are the global and technical health, global and public health experts, not the HR people. And they are the ones that know about all the other jobs that never get advertised. Okay, so this is the way to get through that iceberg problem that I call it. So this is very briefly, very condensed, but I hope it's useful to just open up your mind to other possibilities. And now I'm just going to take a sip of water, and then we'll tackle your questions. Let me see. If you haven't written them down on the Q&A chat, please do. Okay, we have some questions already here, and the amazing people on Team Alanda have tried to organize them for me. So I'm going to go through them, and we'll see how much time we get for this. The first question I have is it worth doing more training, online courses such as biostats to strengthen your skills and to add more value to your CV, especially when you don't have a lot of experience? Yes, it's always worth it doing more training. At the same time, whenever people say to me, I don't have a lot of experience, I challenge them. It's just a matter of how you phrase experience. You have experience from your master's, you have experience from your life, you have experience from your volunteer activities. Experience does not need to mean work experience, like professional work experience where you're employed by someone. And it might, and even if you've been employed, like, at a pizza place or selling shoes or whatever it is, think about what skills do you have from that job experience that are what we call transferable, right? So yes, there's a number of good skills that it's worth building upon, such as science communication, biostats, even, depending on what you want to do next. It could be marketing, it could be understanding a little bit more about businesses and how they work. These little courses that you could be taking if you're curious and this interests you. But also think about figuring out what your skills are. Next question. Is it still worth applying for jobs that require a lot of experience? If so, how do you address this in your application or letter in the job interview? I would say it depends what you mean by lots of experience. Some job offers are not very clear on what is the level of this position. But if you are just starting your career, it is highly unlikely that you will get a senior position straight away, right? The problem is sometimes because we're new in this, we don't know what the title of a senior position is compared to a more junior or entry-level position, right? So we sort of have to navigate this a little bit. And we are in Alanda, we're building some resources to try and help people with understanding what certain job titles actually mean. But let's say it says you need 2 to 3 years of experience, and you're just from your master's and you don't have previous working experience because you just went from your bachelor's to your master's. I would still try it. Because I think you already have experience, like, and then people who have 4 years of PhD or 5 years of PhD behind them is like, oh, I don't have experience. Of course you do. What did you learn in your master's that are actually practical skills? You learned some research skills. You learned how to analyze data. So all of these things count as experience, and you don't need to lie about them, but it's just about how you talk about them in your CVs and in your job applications and in your cover letters. What are you able to do? What are you able to contribute? What's your added value? Okay, so I would say if it's, 10 years of experience, probably not, unless you have previous working experience as a physician or as a clinician or as a dentist or whatever it is, then yes, I would say yes, because many jobs require a lot of the same transferable skills. Okay, would you say that a PhD could even be a barrier for later if I switch fields out from academia, in a way that you could be overqualified? No, I don't think so. It really depends how you present it. There's fewer and fewer organizations where their pay scales are based only on your titles. If their pay scales are based on titles, if you have a PhD, you might be more expensive to them as an employee than if you don't. But since now most organizations have gone on to like a competencies-based salary ladder, whether you have experience or whether you have a PhD, if you have 4 years and 4 years, you'd be more or less at the same level. So I don't think you can be overqualified. There will be some jobs in some positions which, are outside of this general rule that I'm saying, but it won't be a problem, I would say. And you can always downplay your PhD in a job application, in a cover letter, and talk about other skills that you may have. And, a PhD also gives you a lot of job-related skills and transferable skills. The question is about, are you able to identify those skills, those transferable skills? Okay, give me a second here. I need some water. I'm an MPhil in global health. Now I'm determined to pursue a PhD in the same field. How do I enhance my PhD hunting time more effectively? And what important things should I consider to get a PhD? Aha! Very similar to the job application conundrum. If you're only applying to PhDs online, you have the same iceberg problem. So what you want to be doing is figuring out which research groups, which universities, which teams have interesting thematics or interesting research projects that you would like to work in, or what research projects would you like to be doing, and then trying to find an organization and a grant that would be welcoming of that research project that you want to do. And again, yes, you need a university to do a PhD, but think that many NGOs today have relationships with academia, so they can do operational research or implementational research. So there are opportunities for a PhD in other organizations that are not academia. And you might want to look into those as well. So for a PhD, what you need to show is that you have strong research skills and that you aim to continue building on those, and that you're very determined, because, yeah, it can be a bit of a tough road. I mean, it's 4 years more of studying and being a student, and, having to deal with advisors, whether these are great or not, etc. So wait a second, seems like I'm having internet problems. Can you hear me? Can we do a test check? Can you hear me, people? Yeah, perfect. Okay, thank you. Let's go back to the questions. So that's about a PhD, not a very dissimilar question. And remember, if you're able to find the grant for the PhD you want to do, basically any research team will say yes to you. That's the little outside trick. And you might be able to approach, to start looking for grants on your own before even applying to a PhD. So always think, how can I hack this? How can I do this differently than everybody else? Because that's always a great way to stand out, okay? Next question, PhD opportunities globally, and what is generally expected during those 3-4 years? Most specifically, where there are specific databases available. I don't know of any global PhD databases. There's national databases in general. Most countries have some sort of, universities organizing it together and creating a national database. But I don't know that there's any international one where you could just go all the countries in one single go. I think you need to do it more one by one. But if anyone knows of one, please do share in the chat. And then what is expected from you during these 3 to 4 years? It depends. Many PhDs have classes, but others don't, have very, very little classes, and it's mostly your research project. So there's a big expectation in academia to put in very long hours. That is not true. I mean, it's true in some job positions, but not all job positions. And it depends on the country, but in some countries, PhDs are more protected than in other countries. So in some countries, a PhD grant will also be considered as a job. So you have access to the social, to be part of the social, to start enrolling in social services and so on. And in other countries, no, it's just like a grant, and then you're on your own for everything else, for everything that is health services and medical services and so on. So pay attention to those things. But basically what's expected from you is usually to conduct a research project, to show that you can conduct it on your own with less and less supervision over time, and that you can publish, and that you can present at conferences, and that you can help teach new generations of students how to become researchers. That's a little bit what I would say in general terms. Next question, dual career advice asked by someone doing a master's in global health. How to combine medical doctor career and global health? Oh, this is brilliant. I get a lot of comments from people who have a previous medical degree and say, should I not talk too much about my medical degree while I'm looking for a job in public or global health? And I'm like, no, it's great that you have a medical background. That's fantastic. So if you want a full-time job in global or public health and you have a medical degree, that won't be any sort of problem. It won't be any sort of barrier. If you want to combine both, it's just a matter of presenting yourself as someone who likes both, and you can combine it in many ways. There might be some jobs where you can actually do both. For example, in a hospital setting where you spend 50% of your time face-to-face with patients and 50% of your time working on more like public health challenges at the hospital. I can think, for example, of infection and prevention control positions in hospitals, but also in humanitarian organizations for deployments into an emergency scenario. Someone who has both sets of skills is a very interesting candidate, because they can fluctuate depending on the needs of the team on the ground. Of course, you could also, have a private medical practice that you do for 4 to 6 hours a day, and then have a part-time job or a part-time either research position at a university or teaching position or a research position. And there's other ways of doing this, like you could also just try to get into expert panels, for example. As the years go by and you become more knowledgeable, you could be part of an expert panel in your country at the policy level to help to draft guidelines and policy. So you can also be a little bit at the public health or global health level and not just on the clinical practice. So these are just some ideas, and there's a lot more opportunities out there for a dual career. Wow, guys, you're asking so many questions. This is great. Thanks so much for your interest. Could you explain more on networking? I am having issues keeping the conversation going, especially when I don't want it to be transactional. Yes, this is a very good question. Thank you so much for that. Think about two things. To me, networking is about giving and receiving. So giving and asking for help, right? So you give help to others potentially the same person from whom you get help or advice or whatever, but potentially it's more of a pay it forward system, right? People helped me figure out what I wanted to do, and now I'm trying to help others figure out what they want to do. It's sort of like this pay it forward model. So how do you keep those conversations going? There's many ways. You could create a network group of your own. Like, you could invite different people and say, every quarter I'm going to put together this impromptu, and now we can do it, with people all over the world. It doesn't just have to be people that we know in the same city, but you could say, I'm going to put together a virtual event online for an hour, so it's not like taking a lot of people's time, and you can invite people as speakers, or you can have like a discussion on a particular subject, or you can create a panel. So that's one way of keeping in touch. Or you can just create a group where you sit down and discuss, just pass on tips about networking or connections, or I am looking for this type of job. If you hear about something, you can do that with your peers. And then for the people who you're trying to keep in touch, who are a little bit more senior, who might not be in your peer group, again, you can set up events and invite them as speakers to that event, as panelists or so on. You could just now and then say, I came across about this interesting article, I'm sharing it with you. If they are active on LinkedIn, you can always, of course, comment on their posts. You can send them a message now and then when they change jobs, when they have like a birthday or whatever. All these things pop up on LinkedIn. So it's just about being thoughtful and saying, is there some little thing that I can do for this particular person, right? Maybe they are looking for a student for if they're academics, they might be looking for a student, or maybe you have some contacts that you can put them in touch with. There's always little things that we can do. So it's just about being creative about that, and just sending a carefully crafted message now and then saying, I thought about you because I read about this and this the other day. I hope things are going well. And it doesn't have to be more than that, but that keeps you on top of people's minds. We don't have a lot of time left. I'm going to try and get through some other questions here. Could you please point out key players, employees in the field of mental health and well-being? Oh, again, the Red Cross, for example, has a large imprint in the mental health space, mental health and psychosocial support. The Danish Red Cross, together with the International Federation of the Red Cross, has a mental health and psychosocial support research center, sort of like a think tank inside the Red Cross movement, that is based in Denmark, if I'm not much mistaken. But many of the larger NGOs now have mental health components in all of their programs, especially post-pandemic. A lot of people have realized how important this is. And there are partnerships in mental health and psychosocial support that you can look into. And of course, there's hospitals, and now more and more private companies that have nothing to do with global or public health want to make sure that they have mental health as someone with mental health experience as part of the HR team. So there's other opportunities there. Is it required to have medical education or have worked as a health professional before when working in global health? Do you think this is necessary, and what's your opinion on that? No, as I always say, if you have experience, you don't necessarily need the official title. And many jobs will always say, you need like requirements, this and this degree. But more and more jobs today are saying or equivalent working experience. So yeah, it really depends on the organization. But I think if you put forward a strong case that you have a lot of experience, you might not need a degree. What kind of salary in the higher income country can you expect as a junior position after a master degree? This is a tricky one, but because it changes a lot from one country to the next and from one type of organization to the next. But my advice is always do your research. Always try and figure it out. In general, in academia, you will probably find okay salaries. In smaller NGOs, you will have lower salaries. In bigger NGOs, you might have access to bigger salaries. In the private sector, those salaries are even bigger. In the public sector, in high-income countries, they can be, decent, more or less at the same level as academia. In low and middle-income countries, they tend to be lower. When you work in government. So it's also associated with the size of the organization, of course. But do your research and do your due diligence. Know what those salaries look like. Try and find as much information as you can. I am almost out of time. I'm going to answer one more question, and then I'm going to tell you a little bit about the other resources that we're creating. What are some of the major keywords or job titles that you can search for when looking for jobs in the global health field? It really depends on what you want to do. Try things such as technical advisor. You can do project manager, program manager. Those are normally higher level responsibility positions. You can have project officer or program officer that are a little bit lower level responsibility positions. You can have grant manager. So try these things. There's a huge variety of it. We're trying to compile like a database of these, and we'll be sure to try and share it. But every organization has its own title, so it's a bit of a tricky question, but you can start there. And usually global health is not yet as out there as we would like, so try not to use global health, but use public health or something similar. That might work better. Okay, good. I am going to stop there. There's a few more questions that I didn't manage to answer. Let me see. Great. Okay. So because we are very concerned about this huge need that we see in young public and global health professionals in career development, we've been thinking about how we can contribute to close this gap. And so we've been doing a little bit of research. We created a survey to look at what the challenges are. This webinar has sort of reinforced that what we thought are the challenges are actually there. And what we've developed is a pilot course that we're going to be launching from tomorrow, and it'll open for enrollment from the 7th, and it'll open on the 7th of June. So for some of you, the answer, this webinar might be enough, and you might have a lot of fresh ideas, and you can just go out there and start looking for jobs with different methodologies and different tools, and you'll be fine. But others, you might want some additional support. And what we aim to do with this course is provide a very practical course. It's more of a workshop, really, where we guide you through the processes that we've been talking about today around networking and job hunting in a very different manner, and especially figuring out what you want to do, where you want to go next, and understanding what your skill set is, which is not always obvious. And we'll go through some of the classicals and the basics about what is a good CV and a good cover letter look like, but with a twist, because what we do is we look at it, as we did today, from the perspective of the recruiter. So what is the recruiter thinking? What is the recruiter looking for? So we can give you that perspective, which is a little bit different. So what are the course components here? We touch about many of the same subjects that we touched on this webinar, and the course will be is 6 modules of video-based learning, where we address in a similar fashion to this webinar some of the most pressing challenges and questions that we get, but in a much more in-depth manner than I was able to do here today. And then you can work through these modules at your own pace. You can do them all in the same day, or you can work through it week by week. So we have organized it into a 6-week course, because we know that people are busy with the end of their masters and so on, so that you only need to do 2 to 3 hours of work every week. It also contains a workbook that guides you through the exercises, so that at the end of the course, you have already done a lot of the work that is necessary for trying to use a different set of job hunting skills, job hunting techniques, as we discussed today, such as, building relationships that can create project or work opportunities for you, and having a strategy to, as some people were asking, keeping in touch and being on top of people's minds. So you'll have, in that workbook, it's very practical, and we take you step by step along the way. We've also put together sort of a dedicated close community for all the people who enroll in the course, so that you already start creating a community of peers. Because what we tend to forget is that the people that you know today might also be like you, looking for a job, but in 10 years, they'll be in very interesting job positions. And you have your own network, and the people in this course and the people around you have their own networks. And that can be a huge enrichment. It's what we call a mastermind, like a master brain, right? There's a lot of people with a lot of ideas, motivated and engaged, wanting to work in global and public health. So how do we put together this community and nurture this community? So you have this close community where you can get support and accountability. And some of our team at Alanda will be managing this community, and I'll be participating actively in it. So we hope that it's really a plus. And then finally, we'll have a 90-minute sort of Ask Me Anything webinar similar to this one at the end of the course for any remaining questions that people may have, and also as an opportunity for people in the course to meet each other. And because this is the pilot version, so we're piloting this course for the very first time, we're offering additional bonus materials, including some of our favorite websites to look for jobs, to look for trainings, to look for work opportunities, some of our favorite books and podcasts and TED Talks to guide you through your career growth. So we have a little bit of some extras because, it's a pilot right now. So this course we see it as a course that could be useful for two different sets of people. One is young public and global health professionals who are just finishing their masters and are trying to figure out their next step. And the other one is people who, like me many years ago, switched careers from a biomedical or a clinical field into global and public health, and also are trying to figure out how to get a meaningful job and an interesting and worthwhile job in global and public health. So you'll be, I think, if the Alanda team could share on the chat the link where you can already enroll into this course if this is of interest. I think it's already there in the chat, but tomorrow with their recording, you will get a little bit more information about this course, and also a link to the course if this is of interest. We hope that this webinar was useful to you. And if you think you need more support, do take a look into the Thrive course and see if this is for you. We would really appreciate the people who join us for the pilot to help us build and improve it to be able to support more people. If this is not for you, but you know other people who might be interested and you can share it, we would also appreciate that. And in any case, please do stay tuned, because we will continue putting out there more resources to try and answer pressing career development questions and challenges for young public and global health professionals. We need you to be in meaningful and worthwhile jobs where you're motivated and engaged. And I think if the pandemic has taught us anything, is how important that is. We need public and global health professionals out there now. Thank you so much for being here and for listening to me talk nonstop for so long. I really appreciate your time and joining us today. Have a great day.